All right. So, hello everyone. Myself, Dr. Disha Shah. I'm a child psychologist and a special educator and founder of Devruti. Today, I have someone really, really special with me, and it gives me immense pleasure to introduce her. Um, she's Dr. Anuja Khare Joshi. She's a master's and bachelor's in dentistry. She also has advanced training in special training for special needs children in dentistry for and from University of Gent, Belgium, and from Liverpool School of Dentistry, UK. She also has a advanced certified lactation professional, and after gaining a lot of knowledge and experience, she owns her private clinic with and she's also founder of Anandi Lactation Support in Hubli. I'm also proud to say that her clinic is the only dedicated one so far which provide this kind of services. So welcome, Dr. Anuja.
Thank you. Thank you very much, Dr. Disha. Thank you.
Ah, so we all know that lactation is a very complex process, and newly mothers often get a lot of suggestions and advice from different areas, and they often get confused as in which one to opt for or which is right for my kid. To clear all this doubt, we have Dr. Anuja. She's going to help us sort out this simple questions so that it helps us to deal with our child and work with our child in this first 90 days in the infant's life. So let's start, and my first and the very basic question to you, Dr. Anuja, is what is lactation and why it is important?
All right. So, what is lactation? Lactation is basically the act of breastfeeding, the production of milk in the body that happens in the mother once a few weeks after she's conceived. And then the whole process of breastfeeding or nursing your baby is all called lactation. Now, how is it important? It's important both for the mother and the baby. Why for the baby? Because the baby gets every possible nutrition or nutrient that the baby needs in these growing years from mother's milk in apt proportions. So that's why it's extremely important for the baby. Secondly, it builds up a bond with the mother, and also the mother builds it up with the baby, which is beyond nutritive. It's an emotional bond which goes a long way in the growth and development of both of them. And yes, what are the other benefits? It gives the much needed immunity, which is very, very important, especially in the first year of age. And this immunity cannot be given to the child by any other top up or any other outside milk. And it necessarily has to come through the mother until the child is big enough to develop its own immunity. So, this immunity is mainly with regards to the ENT tract, with the digestive tract, which promotes good bacteria, and it helps in the better digestion, that the baby is consuming all of the milk. It just helps in better digestion, smooth digestion for the baby. Also, it releases more of breastfeeding or frequent breastfeeding. It helps in release of a particular hormone called oxytocin in the mother, and this hormone is also very important in the natural contraction of uterus that has, the uterus would have enlarged in size during pregnancy. So apart from all the exercises that the mother gets into post delivery, it's also a very natural and a more healthy way of just getting things back in how they were. So that's also very important. Another important thing is mother's milk has a hormone which is called leptin, which is the hormone for satiety. And this hormone, that's why, breastfed babies rarely are overfed, because this hormone helps them, gives them a feeling of fullness. And it's very important, which is again not present in formulas or any other animal or outside milk. And it gives rise to much more steadier weight gains in the baby. So, the benefits of breastfeeding are just innumerable, and it is extremely, extremely precious for the baby and also for the mother. So, it's just difficult to put everything together.
Right. So, which psychologically there are a lot of benefits of having the mother-child bond. So, which is, you rightly said. So that's very important. So that leads to the another question: how many times in a day should we feed the baby in a day, and which is the ideal number of times that baby should be fed?
Okay. Initially, when the baby is still small and newborn, say up to 7 weeks or 8 weeks, especially the first 40 days, which are very crucial, and say up to 7 or 8 weeks, it is important to regularly or time feed the baby, say every 1.5, 2 hours. Usually, this would be the cap that the baby would wake up in for the next feed. So, suppose your baby has not woken up for the desired time of 1.5, 2 hours, you could think about waking up the child intentionally and just getting things ready for breastfeeding. This is because in the initial days we want steady weight gains, we want good weight gains, and we do not want any dehydration to happen in the baby, and that is why we just are a little over cautious and we make sure that the baby is being fed every 1.5, 2 hours. But this is only for the first 7 or 8 weeks. So mothers generally remember everything else, but they forget the 7 and 8 week part, and they continue to wake up the child every 2 hours, even post the 8 week mark. And then, a sort of worry creeps in that, I wake him up every 2 hours, but he's not taking like how he used to.
Mm-hmm.
That is why it is important to stop there. And beyond that, the feeding should always be demand based. So only when your baby is crying and asking for milk by various, actions, only then should you be feeding your baby. Even if the baby ends up sleeping for a good 3, 4, or 5 hours, and it's a big baby, crossed 2 months of age, you need not worry too much about it, and you could let the baby sleep and only demand feed.
Okay, thank you, Dr. Anuja. But another question comes in: what if the baby is premature born and mother is not able to produce enough milk? In that situation, what would you suggest?
All right. Now, this producing enough milk and I am not having enough milk is a very common question, and most of the mothers do have these worries. What one should know is that production of milk has started in your body a few weeks after you have conceived. So, that is not an issue. There is never going to be a situation where I do not have any milk. All right. So the production has started. Now, how much is it maintained depends on how much of breastfeeding the mother is able to do. The more number of times she's able to feed, I mean the frequency, then the milk supply starts boosting up, because the milk production in our body is very much hormone based and supply demand based. So the moment the body or the brain gets the signal that okay, the milk produced in the breast is being emptied and is used up, or the breasts are being stimulated by sucking or whatever, it starts producing more milk. Okay,
Okay.
so it's very important that that happens regularly and frequently. Now, when it comes in the beginning, that is right after birth or the first few days after birth, it is very natural for the mother to not really have a very great supply. Her supply is very little. Sometimes it's colostrum, like the thick milk, but in the initial days, that much of volume is usually sufficient for the baby because it's a newborn child. So it's sufficient. What is very important in that phase is that the mother should not get stressed or worried that this is the only volume that I am producing. And in all of this, she usually ends up, offering top ups and feeding less. So that should not happen. That should not stop her from putting the baby to the breast. It is very important. Only then is there a stimulus, and only then regularly, if this happens, milk production at the end of 10 days, she will feel that yes, it is better than what it was on day one and day two. All right. So
Okay.
it just comes, it happens that way. Secondly, with regards to premature babies, now, premature babies have not really developed their swallow and suck reflex entirely. So it's difficult for them to actually, latch very well in the first, depends on how
Mm-hmm.
prematurely they are born. So let's say about 1 or 2 weeks premature, it's difficult for them to actually latch on well. And also sometimes they are separated from the mother for medical reasons.
Mm-hmm.
So in such a case, what the mother can do is that she should pump or express, either manually express your milk or keep pumping the milk out, for two reasons. One is she's able to give her child her own milk, even if it is not through breastfeeding, there is mother's milk going into the baby's stomach. And secondly, by regularly emptying the breast, she is stimulating her own breast to produce more milk. So at the end of 2 weeks, hopefully, when the baby is reunited with the mother, she would not really have to worry too much about the milk supply because she would have gradually built it up over the 10, 12 days when the baby was away. So this is something that she should try doing, and it will help both of them, the mother and the baby.
Okay. So, Dr. Anuja, then another question comes that what if mother unable to produce any of her milk, and there is a grandmother's rule like to have your own milk, right? Mother's milk. So nowadays, you know, there are top ups, there are other types of milk or cow milk or a buffalo milk. Which milk should we give to the infant?
Yes, there are times definitely when the mother is sometimes not able to completely satisfy the baby's needs. So they will have to opt for a combination feed. That is, she is doing breastfeeding, but the baby is still hungry, so she has to offer some top up, which is absolutely normal. So the first thing you know through this is that it is absolutely okay for somebody to not be able to produce completely up to the child's needs. All right, I may be producing to my full capacity at the moment, but it may still be less for my baby, which is okay, which is absolutely okay. But if I continue to feed the baby, maybe few days from now, my supply will build up. Whether it is still sufficient for the baby or no, we just have to wait and watch. But it is important to continue to breastfeed. And after that, beyond that, when the baby is hungry, it is equally important to satisfy the baby's hunger with, I personally feel a formula is better over animal's milk.
Okay.
Why? Because a formula completely replicates mother's milk in nutrition, minus the immunity and all the other benefits. But it does replicate the mother's milk in nutrition, exactly like that.
Mm-hmm.
When it comes to animal milk, although animal milk and mother's milk have similar nutrients, but their proportions vary greatly.
Okay.
All right. And animal milk is not very easy for the newborn or the infant to digest.
Okay.
It is quite heavy for the baby to digest. And he will definitely have issues with digestion or passing poop. So it's not very advisable to give animal milk when the baby is so small. So you can wait till the baby turns 1 year of age, after which you can take a call on that. But until 1 year, I feel it has to be mother's milk followed by formula if there is a need for baby's hunger.
Okay.
Also, with this, I would also like to stress on the fact that just out of the fear of not wanting to give outside milk or formula, the mothers should not hesitate and stop there at breastfeeding and leave the child a little hungry. It is extremely important that the baby is satisfied and full at every feed. So at every feed, if there is insufficiency or you are not able to completely satisfy your baby's needs, please do not hesitate to offer the top up, that is formula or whatever kind of formula that you choose to offer.
Okay. So now newly mothers are often confused how to hold the baby because baby is very small and fragile. So what kind of position or is there any particular ideal position that a mother should hold the baby while feeding so that the baby get the maximum milk from the mother?
Yes, there are different ways of holding the baby. We call them different holds, like the cradle or the cross cradle, foot back, a football, laid back, sideline. So many are there. So, of course, every hold has a theoretical way of holding the baby. And as the mother tries doing it and tries and retries, she will ultimately find her way which suits her the most. But in general, I will maybe show you two holds which are commonly used by the mothers, or mothers usually feel comfortable holding the baby in those holds. Firstly, what you need to understand is that when you're feeding your baby, suppose this is the baby, it is very important that the baby is facing the mother.
Okay.
Okay. Most of the times, the baby is like this with the head or neck of the mother baby towards the mother's breast. But this is not how it should be, because it is not easy for us also to eat and drink like this. We should be facing our food, and it is as simple as that. So the baby has to be facing the mother with a nice tummy to tummy contact.
Okay.
Okay, so sit upright, sit straight, sit comfortably, take as many cushions and pillows as you want. There have to be one or two number of cushions on your lap also, such that the baby is at the level of your breast. All right, so one or two, how many ever are needed. Then the baby has to be turned towards you such that there is a good and nice tummy to tummy or skin to skin contact with your baby. Then how do you also remember that do not bend down to put the breast inside the baby's mouth. The mother should not be bending down in any way. She should be sitting upright and comfortably, and it has to be the baby who comes onto the mother's breast, and the breast does is not pushed into the mother's mouth. All right.
Okay.
So once you are sitting upright, hold the baby with a thumb below one ear,
Hmm.
another finger below the other ear, and two fingers which are supporting the head.
Hmm.
All right, the body can be supported by the forearm, and this is how the baby comes to you nicely and snugly. Okay, so hold the baby nicely. It gives a sense of comfort to the child and also makes you a little more confident and comfortable to breastfeed.
Hmm.
After that, this hand, which is free, has to nicely scoop your breast. Okay, so scoop the breast very nicely. It gives a good grip for the baby to hold on or latch on to your breast, making things easy for the baby. All right, so this is one hold, and the football hold is a hold wherein the baby is held slightly behind. So if this is how I am sitting on a chair, most of the baby is behind me. So you will need pillows and cushions here to support the baby such that his legs and bum is not falling down. So there have to be enough support here. Hold the baby in a similar fashion, and there is again a tummy to tummy or a tummy to skin contact, and the baby reaches your breast from below, like how you hold a football. All right, so that's the football hold.
Okay.
There are times mothers feel that one hold is comfortable on one side and the other on the other side, which is absolutely okay. So you have to do a little bit of trial and error with the positions and see what is working best for you and your baby.
Okay.
Also remember that babies do have a preference of one breast over the other, which is very normal. So
Okay.
sometimes some mothers say that, on left side is latching so well, perfectly, I have no issues. But on right, we are struggling. Yes. Or right, he's not happy. He just wants to latch on left, which is fine. Okay. They do have preferences. So in that case, you need to try different holds or different ways of holding the baby onto the other side. Again, so there are basically two aspects to breastfeeding, which the mother needs to learn and understand.
Hmm.
One is about positioning, and the second one is just trying to know what exactly latching is. So, what is latching? Latching is the way the baby holds the mother's breast.
Okay.
So, if this is the breast
Hmm.
and this is the nipple, which is the most, which is the projection in our breast,
Hmm.
what most of us feel is that if the baby holds his or her lips around the nipple, this is where the baby is going to get his milk from. But actually, the milk is in the breast. It is not in the nipple. Nipple is just a way through which the milk is passing from the breast into the baby's mouth.
Mouth. Okay.
So it is important to hold the nipple, hold the breast around the nipple and not on the nipple. Also, now where around the nipple? So you see this black circular portion around the nipple, which is called as the areola. Now it is difficult for any baby to open their mouth so wide such that all of the areola goes into their mouth. So it's basically the nipple and the areola below it. So this is the portion that necessarily needs to be into the baby's mouth. And once the baby holds the breast like this and starts sucking, then the flow of milk would be much easier, smoother, and breastfeeding would be painless.
Okay. And for how long do you suggest that mother should breastfeed the babies?
Okay, the ideal breastfeeding session, if the latch is correct and if the flow is good enough, should not go beyond 20 or maximum 25. 30 is like maximum. So 20-25 minutes should be sufficient for the baby to
Okay.
breastfeed. When the sessions are prolonged, 40, 45, 50 minutes, that is when there is something going wrong. So you just need to recheck whether what the way the baby is latching onto the breast is that correct, there can only be two issues when the breastfeeding sessions are too long. Either the latching is not correct, and that's why the baby is not getting the desired flow in a desired manner, and that's why it's taking longer. Or secondly, maybe the milk supply is slightly the low, and that's why the baby is finding it hard to get as much milk as the baby wants.
Okay.
So, we just need to relook into some things there.
Okay, and what would you suggest after 6 months, mothers should stop breastfeeding or after 1 year? There is this confusion going on. Working mothers, they stop, breastfeeding the baby by 6 months or 8 months. So, what do you suggest? What should be the ideal ones?
Okay, see, actually, breastfeeding itself is a choice. So it cannot really be forced onto any mother.
Okay,
Secondly, similarly, when to stop free breastfeeding is also a choice which the mother makes knowingly, knowing her situation and environment.
right.
But ideally, what is beneficial for the mother and baby? Definitely breastfeeding for as long as you can, for almost up to 2 years is
Okay,
what is recommended by the World Health Organization.
okay,
Our Indian Academy of Pediatrics also says that should not be anything less than a year.
okay.
So, mothers should try to breastfeed as much as is possible. Exclusive breastfeeding for 6 months is important,
Mm-hmm.
but sustained breastfeeding for a longer time is equally important.
Important.
All right. So that is how one should look at it.
Okay, and lastly, last question is, you know, uh, because there's a lot of oral and the latching and all those is involved. Any suggestion would you give for hygiene purpose, or it's just absolutely okay to just leave the baby the way it is after breastfeeding?
Oral hygiene is very important because equally important is mothers making sure that their areola, nipple, and breast is kept clean so that there is no passing of infection from the nipple onto the into the mother baby's mouth and the other way. So both are equally important. So after feeding, mothers should try to wipe clean the too far behind. So it is important that you keep these things in mind and keep cleaning baby's mouth regularly. Once you see the first tooth has erupted, could be somewhere around 6 months of age, but not necessarily. It could be plus or minus 1 or 2 months here and there. So once
Okay,
the tooth has erupted, again a similar pattern of cleaning has to be followed for the first tooth, or you could use a baby brush or a finger brush. Although finger brushes are not so very recommended because they're very soft, but if you are able to use them to clean your baby's teeth, fine. In the beginning, that is okay. And gradually, you can shift to a baby brush. All right.
okay.
But please make sure that oral hygiene is maintained. And teething does not come in the way of breastfeeding. So please remember that, keep that in mind, and that should never be a reason to stop breastfeeding once teeth have erupted.
Okay. So thank you, Dr. Anuja, for sharing all this valuable knowledge. Uh, And
Thank you.
if anyone has any question, they can put up the question in the chat box. Meanwhile, Dr.
Yes,
Anuja,
I.
if you can share your email ID in the chat box so people can connect to you as well.
Yes, I will do that. I will
Uh,
share my email ID in the chat box, or you can also Google and find us Anandi Lactation Support Hubli in India,
okay,
or you could just email us.
all right.
So there.
So,
Yes.
uh, thank you, Dr. Anuja, for sharing all this information. Thank you so much for coming in.
Thank you. Thank you very much, Dr. Disha. I really hope it's helpful for new moms or moms who are, expectant mothers. And thank you so much for having me over. It's always a pleasure to talk to you.
Thank you. Thank you.
Thank you. Thank you.